Okay. According to the American Red Cross, every 2 seconds, someone in the U.S. needs a blood transfusion. That means, in the time that it takes me to give this speech, about 150 people will need blood. Unfortunately, due to the shortage of donor blood here in our country, many of these people will not receive the blood that they need. Luckily, there's something that you can do to help, and it only requires 1 hour every 56 days. Today, as you can already tell, I'm going to talk to you about blood donation. First, I'm going to give you a few reasons someone may need a blood transfusion. Second, I'm going to tell you why you should donate. And last, I'm going to tell you how easy it is to become a blood donor. If you didn't know before, now you know that there are many reasons that someone may need a blood transfusion. It wasn't until after my first donation and a little research did I learn about all the reasons someone may need to be given blood. According to LifeShare.org, 30% of all donated blood goes to cancer patients. Chemo, radiation, and even the cancer itself can lower the patient's blood count, which requires them to get a blood transfusion. Along with cancer patients, surgical patients, trauma patients, and even newborn babies can need blood transfusions. These may just sound like statistics to you, but for others, this is their life. They may be one of those 30% of cancer patients who need blood, or one of the 5% of hemophiliacs who blood doesn't clot properly, which puts them at risk for bleeding out. Although the reasons for needing a blood transfusion can vary from case to case, one thing all of these cases have in common is they all rely on the donation of blood. Now that you know some reasons why someone may need to be given blood, I'm going to tell you why you should donate blood and why you should donate regularly. Unlike other drugs and medicines, blood cannot be made in the lab and it cannot be substituted for any other substance. This is why donation is so important, as this is the only place that blood can be obtained. One donation can save up to 3 lives. One day, you or your loved one could be one of these 3. And with less than 38% of the population eligible to donate, that's why it's so important for donors to donate regularly. Over the years, the need for blood has increased while the rate of donation has decreased. This has created a blood shortage crisis here in our country. And if we continue in this crisis, doctors and nurses will be forced eventually to make life and death decisions. So that means that the car crash victim may receive their blood transfusion in order to survive, and the 5-year-old cancer patient may not receive theirs, even though it's essential to their treatment. I know that these are extreme and uncomfortable cases, but this is the reality that we're going to face if we continue in this crisis. I understand even if you know the importance of donating blood, you can still be nervous. I'm going to tell you a little bit about my own personal experience with the process and how easy it is to become a donor. Like many others, I was a little nervous before my first donation. The first thing I did was I chose a center. I chose Carter Blood Care because it was the closest center to me. After I chose the center, I made an appointment. After I arrived at my appointment, I filled out all the necessary paperwork and gave my full medical history. They then did a mini physical where they checked my weight, hemoglobin levels, and blood pressure. After checking all these things, they determined that I was eligible to become a blood donor. The actual blood retrieval took only about 10 minutes. The recovery time after took about 15, so from start to finish, the whole process was about 1 hour. All it took was 1 hour to save 3 lives. Now that you know how easy it is to be a donor, I encourage you to get out there and to donate as often as you can. There are people all over our country who need your donation, so give the gift of life. Donate blood. Thank you.